Welcome back. Today we will learn a topic under neonatology. We write the heading. It's neonatal hypothermia. Very important topic. Neonatal hypothermia. Yeah, it's very basic common wording. Hypothermia means low temperature. Yeah, there is no doubt, right? Okay, we'll start. So first, to say something is less or more, we need to know what is the normal temperature. So normal, it lies between 36.5 degrees Celsius to 37.5 degrees Celsius. Yeah, right. Then obviously if we call it as hypothermia, it should be less than the upper limit. So it should be 36.5 degrees Celsius, less than that. Okay. Yeah. Did you write? Yeah. Then we'll go with the grades. This is a very important topic. Let's make it a crisp so that you will revise very easily and there will be no confusion. Don't make the notes very bulky so that you can't revise before the exams. It may be competitive or even your theory exams, right? Yes. Grades or severity. There we have cold stress, which is 36 degrees Celsius to 36.4 degrees Celsius. Then we have moderate, 32 degrees Celsius to 35.9 degrees Celsius. Then we have severe, less than 32 degrees Celsius, right? Okay. Yeah, then we'll move with the mechanism of body temperature monitoring. So we mechanisms. There are four types of mechanism. First one is conventional, where this is a instrument and think that this is a baby, right? Yeah, adjust with the diagram. So this goes like this. Then we have radiation, where the instrument lies bit far and the baby will be here, and this. Then we have conduction. Yeah, this is a very basic physics. It passes from the above to the lying down surface. Then we have evaporation. No need to explain, I guess. Like this. Baby lies here, okay? Don't get confused. So special point of this is you need to remember transepidermal water loss will take place, or insensible water loss. I hope there is no doubt, right? It's very crisp. Then we'll go with the next part. We'll change the pen, right? Yeah. So we have mechanism of heat production in newborn. Like, it is not similar to the adult people. We have different mechanism. We will brief about it. Mechanism of heat production in newborn. Usually adults, we people, when we get cold, we just like shivering starts and all. Then what happens, our body produces heat so that temperature will be maintained. बच्चे को तो ऐसा नहीं होता ना, it's different. Okay, then anyone know what kind of heat production mechanism will be there in newborns? Yeah, That's right. We have non-shivering thermogenesis. So what does it mean? Usually babies have brown fat. So where all it is present, it may be around axilla, mediastinum, perinephric region, right? What happens is like it prevents body temperature to go down, like it doesn't allow the heat loss, so that it will maintain the temperature. So this is a simple mechanism. Then what all preventions we can do to prevent this hypothermia? So we'll do right. They are like preventions. So at birth, we can prevent it by some external factors like maintaining temperature of our delivery room, or even maintaining temperature of this if the baby goes to like initially we will take the baby for the examination in the NICU, maintaining the room temperature of that NICU, or we can just give kangaroo mother care. So what is the temperature you have to maintain in the delivery room? It's around 25 degrees Celsius. Then about NICU, when it comes to, it will be 22 to 26 around. Okay, it's 26. Then KMC detailed video is on that community part. So this comes under community. You can read it in detail. We have already uploaded the video. So for more information, you can check out in my community section, PSM section, right? Okay. Can be given by any parent. It may be mother or a father. Preferably, we prefer a mother. Okay. Like we'll give a chair, and this will be a mother lying down, and we'll ask the baby to keep on her chest, so that it shares the same temperature. That's what basically it means, kangaroo mother care. So what are the components? Let's talk about in a small brief thing. We have 3 components. What and all? Position or skin to skin, as I said. Contact, then breastfeeding, early discharge, and follow-up. This is just a crisp part of the KMC. That is also very important topic in comes in under PSM. You can look into that video. So next, what all we can do? Yeah, when we take the baby, we'll take it to the radiator or incubator. Not radiator, radiant warmer, so that we can keep the baby warm. So write down incubator, then radiant warmer. So there is a specific something like we are having 2 things means, then we have to know where to use that particularly, right? So incubator will be used if the baby is less than 32 weeks. If the baby is above 32 weeks, we use radiant warmer. So we discussed it about like mechanism of heat gain and heat loss. So guess before knowing something. If you guess, if it is correct, you will remember. If it is wrong also, you will remember better. So whether it will be conventional or radiation for the heat gain, yeah, it is a conventional. Then radiation, remember one, so that it will be ulta. here it will be radiation, here it will be convention, right? Yeah, that's it. Let's revise quickly so that you'll remember better. Neonatal hypothermia we discussed. So what is the normal temperature? 36.5 to 37.5. Then what it is like to be called as hypothermia? It's 36.5 degrees Celsius, less than that. Then we studied about grades, which is cold stress 36 to 36.4, moderate 32 to 35.9. Then we call it as severe, or like it's under 32 degrees Celsius. Then we discussed mechanism. We have 4 types: conventional, radiations, conduction, then evaporation. Then we studied about mechanism, where we came to know about non-shivering thermogenesis. Then we have preventive measures to prevent the hypothermia of the newborn baby. So by maintaining delivery room temperature 25 degrees Celsius, NICU 22 to 26 degrees Celsius. Then about Kangra mother care, so that it can be any parent, preferably mother. And we talked about components of KMC. It is related to position, skin to skin contact, breastfeeding, early discharge and follow up. Then we talked about incubators, then radiant formers. That's it for the video. Hope you all enjoyed the video. Many people don't subscribe for more video and for more knowledge. Hope you guys enjoyed. Thank you.